So, I can do, Christine, nobody needs you to introduce themselves, but do you want to introduce yourself anyway?
All right, okay, yeah, Christine Middlemiss, I'm the UK Chief Veterinary Officer, but an England Chief Veterinary Officer as well. I raised that in this space because you'll know that policy, Scotland and Wales get to make their own policy, so I can, I'll talk specifically about England and refer maybe epidemiologically to Great Britain or UK.
Yeah, great.
Thanks.
Yeah, Sinead?
Hello, I'm Sinead Timothy. I am Technical Manager at Boehringer Ingelheim.
Ellie?
Hello, I'm Ellie Layton and I'm Livestock Reporter at Farmers Guardian.
Kelly?
I'm Kelly Hennigan. I'm the Deputy Editor at the Scottish Farmer.
Hannah, because I'm sticking to ladies first.
Very polite. Hannah Lloyd from Pinstay, and we've been involved with the Battle Bluetongue campaign.
Philip?
Yeah, Philip Clark, News Editor at Farmers Weekly.
Ben?
Morning, Ben Briggs, Associate Director at Pinstone, formerly of the Farmers Guardian Parish.
And I'm Neil Shan, CEO of the National Beef Association, and also the Scottish Beef Association now, but we'll park that now and leave it aside. So the reason for this is to try, if we possibly can, to really raise awareness in regards to some of the stories we're seeing on the ground in England and a little bit in Wales as we start spring calving season. We're seeing high levels of abortions and dummy calves, calves being born with partial brains, or in some cases, no brains. And we're seeing this across the whole of England, really, from Oxford, Devon, Cornwall, Shropshire, Staffordshire, Cheshire, a few in Cumbria, Derbyshire, East and West Sussex. But possibly interestingly, we're seeing very little in the eastern counties where there would have been a relatively high uptake of vaccine last year because they were all in the zone. And I think that's a pertinent point that, you know, there's been next to nothing that I've seen posted on a link to a page that we'll share with you at the end. I think, Hannah, you'll maybe share the slides with the press team. So we're, you know, this is a real plea from me that the main printed media put out a message this week, if possible, on the need to vaccinate. This time last year, we didn't really have a great availability of vaccine that we would have had confidence in, and a lot of cattle were turned out in the spring before the vaccine was available. It's really different this year. There's plenty of vaccine available, and now's the time. You know, in the next 3 to 4 weeks, people will look at turning cattle out. You know, early calved cows could be going out even in the next 2 or 3 weeks. So I really want to put a message from me and from everyone, I think, involved in the whole Battle Bluetongue campaign, of which there's been many, to get people to think about vaccination. So that's really my opening comments. I will throw something in that's non-related to perhaps England or Wales, just as a comment that Bluetongue's now been found in the Isle of Man, and they saw no clinical signs. They saw nothing until they started getting a high level of abortions. This disease is silent and it's also invisible. In most cases, it's not spotted until the damage is done. And with the value of livestock at the moment, you know, that analysis versus the cost of vaccine, particularly in cattle, it's a no-brainer. You know, if you lose one calf, you know, the net value of that, if it's reared and sold on, could be 2,500. You know, to vaccinate a cow, it's £5 or thereabouts. So that's really all I wanted to say. Christine, I'm putting you on the spot here. If there's anything that you want to add or expand on.
Well, not really. I guess sorry, I lost my train of thought. I was thinking, yeah. So we see few clinical signs in adult animals, right? And so people might think, as Neil said, is, oh, I've missed it, or it's not that bad. But the clinical sign that you're not yet seen is the reproductive one, and if it's going to come some months down the line from infection. So you've got to be thinking that time ahead, before bullying and things like that, to give the right protection at the right time. And that's why we're saying, you know, vaccinate. Think about vaccination now, before you're putting the bull out, while you can still handle the cattle, they're inside and so on, rather than waiting to see if there's impact in a number of months' time. Because what we saw last year, low clinical impact in adults, and then we are seeing an uptick, and it's variable. It can be 1 or 2 on some farms, but generally more reproductive impact than you would in a normal year without Bluetongue.
And we've seen in some herds last year, not this year, last year in Suffolk, Norfolk regions, 30 to 40% losses, and those herds have vaccinated last spring, and have reported 90+% scanning rates and no issues at calving. So I suppose we open it up to the press if there are any. Hopefully there are questions.
Yeah, can you just give us an update on number of cases and where we are this time of year compared with where we were last year?
Bear with me, because I said I hadn't done all the reading I expected to, and I'll come back to you with that.
So with the links we will share at the end, Philip will have the live situation from gov.uk. Off the top of my head, it's 300 and something since the summer of last year. It's in that range. Many of which were found during winter surveillance, I think. So again, no clinical signs. Yeah.
Yeah, that's what I was going to say. So when we say cases, we're meaning where we've confirmed, because we have a blood test positive, there's been no reason to test. Some of those are because of few clinical cases in adults. Some of them are because they've been investigated because there's been a reproductive problem, more barren cows or whatever. And some of them are from their surveillance, where we did the winter surveillance to understand prevalence. Because people, when you read cases, you think, oh, yeah, there's necessarily clinical impact around that and things. There's a variability there. And of course, we found our first incursions because of the surveillance rather than because of clinical disease.
And it seems that with our genetics and maybe our geography and maybe our climate, this strain of Bluetongue has behaved in a slightly different way to what we saw on the continent, where they suffered significant losses in sheep. We probably can say we've seen significant losses in no species, but real challenges on, as Christine says, the reproductive cycle on bovines. And if you look at the government website, there's next to no cases in sheep unless it's maybe been a pre-movement test.
Yeah.
As we've got Sinead
number of cases in the chat. Found it.
As we've got Sinead here as well, if you've got specific questions, because I know there's been an awful lot of myths circulating online amongst farmers and that around vaccination and when and what and how. Obviously, she can answer from a technical viewpoint about their vaccine, which is licensed for cattle, isn't it? Would it be helpful to have a quick overview for your?
Yeah, if you could remind us of the sort of the best strategy in terms of timing of vaccines and where and how many, etc.
Yeah, so the vaccine we have, like all that are available, is licensed for cattle and for sheep. For our vaccine, it's a 2-dose primary course for cattle and a single dose is the primary course for sheep. Animals are protected after 3 weeks after completion of the primary course. So 3 weeks after that single vaccine in the case of sheep, and 3 weeks after the second vaccine in the case of cattle. And I think, as Christine said, the message we're communicating is that by vaccinating now, you can, in the case of spring calving animals, protect cattle ahead of bulling, but also have that protection in place ahead of the risk period, which will sort of begin, the risk level will begin to rise probably around April, May time, and continue to rise as we go into the summer. Interestingly, we are seeing very high uptake of vaccination in Ireland currently. There's a real move to get that. Obviously, they're a very spring block calving national herd, but there's real recognition, I think, of the value of getting that protection in place ahead of the bull going out and ahead of the risk period, because this awareness of the fertility impacts and of the risk on pregnancies of infection in the coming season has been really recognised, I think, over and widely communicated.
And Siobhan, would it be fair to say that in Southern Ireland, their first awareness again of the disease was high levels of abortion? Again, there was no early indications of clinical signs or anything. It was just empty cows and dead calves, unfortunately.
Yeah, surveillance monitoring, and then
Yeah,
I think
it was the
piecing the
surveillance
jigsaw
in cull
together.
cows.
Mm.
They found it in cull cow surveillance first. So yeah, no clinical signs.
And then I think that's then triggered, and like you said, in the Isle of Man, I think it was similar, Neil, that sort of then triggers the pieces of the jigsaw when abortion rates are high or fertility is not what it was expected to be.
And unfortunately, I think scanning rates for this year's calving were lower than normal across the country, and lots of people suggesting it was, again, climate related, an early and long dry summer last year, and that's getting the blame. But I would be suspicious that because we see good scanning rates in bits of the country which had exactly the same climate, so it perhaps was not weather related last year. It maybe is disease related.
And we should remember, it's often any vaccine, farmers often think that it's the vaccine that gives a potential temperature spike and creates infertility in your bulls or tups, where it's more likely to be infection. So you should vaccinate before you need to use your bulls or your tups to make sure they are protected and you're not going to have any temperature spike, because it's not just the reproductive failure in the female. It can, if you get reduced sperm production at a key point in when you're needing to use them, or before you're needing to use them, so that the sperm coming through are not as motile, then that's a big impact for you.
Yeah, I think good. Sorry, I was just going to say that good practice when we know there's a disease challenge would be to vaccinate bulls now and then semen test them in 6 or 8 weeks time before you use them. That would be really good practice.
Yeah.
Sorry, Ellie, I think you were going to say something.
Yeah, sorry, I was just gonna say, could you just give us remind me of the advised time before vaccinating before using bulls?
So
Siobhan, do you want to answer that? So I'm going to say 8 weeks, but yeah,
I'd agree with what you've said, Neil. I think the more lead in you can give them, the better. Having that protection in place again ahead of breeding. And standard advice for any bull really would be to fertility check before breeding, I guess. So yeah, that would be best practice.
What's the advice for sheep, particularly coming up to lambing time, in terms of stress on the animal, timing, etc.?
Yeah, I think the message has very much been, from our perspective, to speak to your own vet about this. There is industry guidance produced by the Cattle Vet Association, the BCVA, and the Sheep Vet Association as well, on timing of vaccination around things like pregnancy and so forth, which we were involved in the discussions ahead of those being developed. It varies between farms, but I think overall the vaccination does not carry a specific risk when it's used appropriately. Whereas, as Christina said, having the virus circulating the risk of your animals getting infected does carry a very specific risk. So, and although we haven't seen the clinical signs that perhaps we expected in sheep based on what's been observed in parts of Europe, the reasons for that are not fully observed. And I think as we're seeing the virus move towards the more livestock dense parts of the UK, we need to be aware that the disease picture could change, I suppose. So there's still a reason to protect both sheep and cattle against the virus.
I think that's
And
an
would
interesting. Sorry, carry on, Philip.
No, I was just going to say that we know that. So the first disease confirmation was, by memory, of November 2023, and then it's rolled on since then. It's certainly overwintered from 24 into 25. We've seen larger positive cases during surveillance, during the surveillance at the end of 25. So it's logical to say that we're at higher risk this year than probably what we were last year. And the data that we're seeing on empty cows, abortions and calf losses is whilst it's not out of control, it's at a really high level. And we know it's a disease that's underreported anyway. So I think we need to really put the focus on the need to get vaccine into cows before they're turned out. There is still time. You know, the window's getting tight, but there is still time. Sorry, Hannah.
So I would word it slightly different and say, I mean, I absolutely agree. We had overwintering 24, 25. We'll have it this year, and we'll have it in more places across the country because we know that the midges are in more places across the country. And we had, particularly in the southwest, which is so Cornwall area, which is warmer, denser cattle population. We definitely had more farms and more animals in farms testing positive. So therefore, the assumption has to be, and especially if we get a warm spring, that we'll see activity sooner, and a lot, potentially lots of, because of that, lots of midges around, and so more farms there's a likelihood that more farms could be impacted, and so that comes back to why we want to get this message out now.
What would you say? I know you've sort of covered it, but are the main on ground feedback you've had from farmers is abortions, sort of calves being absorbed, but also a lot of people are reporting delayed lambing and calving, almost like they've sort of maybe missed a cycle at the start. I don't know if what are the main things, and also how have you found farmer communication? Have they been more open the more that this has been spoke about year on year, or is it sort of the having to go on farm to get those results?
So I don't think we didn't miss them in the earlier years. I think they because the infection level was much less, and certainly 23, 24, we think we didn't see any evidence of overwintering. So I think there was just less impact and less infection, but that's changed now. And so, well, we're hearing it, in different ways through our surveillance systems, and the veterinary investigation laboratories and things. Then the feedback, we work really closely with Neil and colleagues, so feedback from cattle and sheep scanners, things like that. And it might not be that you missed cycle, it might be that thing about that tup had been infected and was infertile for a period, and so they missed the first cycle rather than they didn't have it, were improved, or they used a different tup for the second time round. So it all feeds into this plan ahead, right? Because we don't know what the weather, so we're saying there'll be overwintering, there'll be infected midges. We don't know what the temperatures will be like, whether it'll kick off and we'll get midge activity in May, or whether it'll be more delayed. We don't know any of that, but we know that you can get these reproductive impacts. Don't wait to see them. Vaccinate now.
And I think that's a very clear message. Ellie, so one scenario we saw, and this was 24 into 25 rather than 25 into 26, but it's still relevant, was one farmer with 3 fields of cows. And if you can imagine, they were all in a line. So the middle field had a very poor scanning rate, and the outside 2 had high 90s. So we assume that the bull was impacted in that middle field. Therefore, so many of the cows were empty. I have a concern, like I think AFA and DEFRA would have, that this disease is still way underreported. So the cases that we're actually seeing reported on gov.uk may just be a fraction of what's really happening. And we also work with an industry that works extremely hard and is very proud of what they do. And it's sometimes difficult to publicly share pain. And they need to realize that there's people, we're all here to help and help people in challenging times. And, people that lose a few calves, that information will not all be coming out. But as Christine says, you can prevent it now. You can't, once the bulls are out and it's halfway through the summer, and, there could be a high indices of disease being transferred by midges, it's too late. I mean, we talk a lot about the weather and we're told it needs to be warm. And I'm not in any way an expert on the weather, but last year was very dry, but only dry. Now, my understanding of what I've seen of midgie behaviour is they like dry and wet. So if we get a mixed kind of season, the impact could be greater. Hannah, sorry.
Thank you. Yeah, I was just building on a couple of the points that have been discussed, because something we've seen through the Ruminant Health and Welfare and Battle Bluetongue working right across the industry and across the 4 nations has been a consistent feedback loop from farmers around sort of essentially myths that are circulating on the ground. So I can't stress enough, speak to your vet and listen to the science, listen to the accurate information, because people are saying, well, there's only been a handful of cases, so what's the problem? And it's, obviously this is where the numbers don't tell the full story. So thinking about, we now have anecdotal evidence across over 12 months, which is really helping build a better picture. So it obviously, farmers trust and read your publications and take it as gospel. So that's why it's so important that we can help break down some of those myths, really, because there has been an awful lot of crazy stories circulating amongst farmers from what we're hearing on the feedback loop. So
And I think, Hannah, just building on that, there's a lot of us that remember 2007-8 when Bluetongue was probably a new disease that was talked about in the UK, and a lot of negativity towards the vaccine. We have, as you say, we've got more than enough evidence to show that it's the disease that causes all the challenge, and the protection is the vaccine. It's that simple.
Yeah, and I think that's where the concern has come back again to low scanning rates and abortion. That is what was spoken about back then, but obviously the blame more went to the vaccine. So it's, that's spot on. Thank you.
Yeah. Any further questions or points requiring clarity, please? Well, that's been rather easy.
If it's okay, Neil, I'll just quickly whiz you through these couple of slides, which I'll circulate to you all, but there are a wealth of information available to farmers and their vets to work through. So let me just super quickly share this, because then again, it's obviously helpful to signpost this information that's available for farmers, if that's okay.
So while Hannah's getting those slides up, I will just say, and Christine has been made very clear at the start, we're only talking about England here. My message on vaccination covers all GB countries, and Northern Ireland for that matter, because they've also identified the disease. The midges don't see the borders, and they maybe don't see the slight differences in policies. They will go wherever the wind takes them. And now it's in the west. Our prevailing weather comes from the west.
Yeah, I can say, and 3GB CBOs did right last autumn. We do all support vaccination. Whilst the policy for all of us is to encourage vaccination, because it is the best way to protect your animals.
Yeah, absolutely. Hannah, back to you.
Thank you. Yeah, I mean, just to say, rattle through what's available, and there's a wealth of information. And I think what's been really interesting about Bluetongue and BTV3 in particular has been the industry's response. Obviously, it was a new and emerging disease, strain of disease. There was no vaccine available in the early days. That's been rectified by the industry, and the industry has worked incredibly hard. I've not seen anything like how the industry's worked together on this. So I think it's important to stress that point, that, yeah, there's no one voice in this at all. So yeah, we know who's on. So here's
Hannah, I want to completely underline that it really has been since the beginning work with you know, us in government, but hopefully not us, you know, a big hand out to help industry and vets to know what's going on out there and the best approaches to take, and working with the pharma companies, with yourselves, getting messages out. We are speaking jointly as the best way for farmers to control disease and protect their animals. It's not about pushing, you know, it's a joint voice. It's really important to underline that.
Yeah, totally agree. And I think we've always said that farmers will listen to who they trust and read what they trust. So that's why it's important it comes from a unified voice. So there is a wealth of information available that's been developed over the last sort of 18 months, 2 years. There is a vaccine decision maker tool, for example, that helps you do that cost analysis. And as Neil makes the point, that is ever more a stronger case as the price of cattle in particular is where it is at the moment. There's checker to help know about movements, again, with the devolved policies in place. There's comparison tables around the different vaccines. There's all sorts of information that is available all through the links I can share. We have been having a specific focus around dummy calves and infection in calves this spring, obviously based on all the hearsay and the information we're hearing back and the stats. So again, there is a lot to work with there. And just really to share these couple of links, which I'll send this round so you've all got your hands on this and can pull what you need from it. But yeah, obviously the government sites are where the formal updates come from. And then the Bluetongue Hub through Ruminant Health and Welfare has been a collective central point where we've been signposting in and out to all information. And as I say, there has been a huge collaborative effort across industry behind this and across the devolved as well. So
Great. Hannah, has anyone got any questions on those 3 or 4 slides? Hannah's going to circulate them so you'll all get access to them. Any other questions, well, not generally, on Bluetongue? No, right. So I suppose the final message from me is that, you know, again, a plea that the main printed media can get this message out this week while there's still time for people to act. It's really important that all, you know, beef producers and dairy for that matter, you know, have a discussion, and sheep, with their private vet to find out what is the best options for them at a farm level. But I think vaccination will give protection and protect and help towards better results next year.